Hello, this is Dr. Richard Bain, who is coming to you from University of Southampton today, and I would like to talk to you about the BSc Honours in Cardiac Physiology, which is a programme we run here at Southampton, and we're one of 11 universities that run this programme across the country. Now, most of you will be forgiven for not knowing what cardiac physiology is, because most people who think about hospitals, depending on your age, will maybe think of carry-on doctor, carry-on nurse, or your Holby casualty type people, and you assume that hospitals are full of doctors and nurses. And of course they are, and what a marvellous job they do, but there are other professions that work in a hospital. So your knowledge of healthcare could come down to your age in terms of what you watch on television, and maybe some of this stuff is going back a little bit beyond your years. So how many different professions can we think of that work in the NHS? So obviously doctors and nurses, tick, well done. Maybe you might know about a radiographer using ionizing radiation to image bones and parts of the body, of course. Maybe you might think about people like phlebotomists who take blood from patients so they can go off and have blood tests and things like that. Maybe a physiotherapist, podiatrist, all sorts of professions that work in the NHS. Now, the NHS has changed, and one way it's changed in particular is technology. And we use technology for the prevention, diagnosis, treatment, and rehabilitation of our patients. And what the government did in around 2000 was it didn't know what to do with a whole host of healthcare professions that didn't fall into traditional categories, like your doctors and nurses and your allied health professions, and it called them healthcare science. So you're forgiven for not knowing what this all means, but the government has decided that all these 50 professions will come under a banner called healthcare science. And there are over 50,000 healthcare science personnel involved working within the NHS, and everything they do really involves looking after patients, either prevention, diagnosis and treatment, as we said earlier. Now, just to break that down for you a little bit further, part of that reorganisation, the government came up with life sciences, physiological sciences and physical sciences. So life scientists are people that investigate the cause of illnesses and how it progresses, and they tend to be like microbiology, cellular pathology, those types of things, lab-based careers. Physical sciences, these people involved with developing new methods of measuring what's happening in the body, and they're sort of working in medical physics, even learning media type thing. The one we're interested in is physiological sciences. So we sit in physiological sciences, and within there is our audiology, cardiac physiology, respiratory physiology and neurophysiology. So these are all specialist fields looking at a specific body system. And out of all of those, cardiac physiology is probably the largest of those professions. So cardiac physiology, healthcare science, the terms are being used interchangeably, and we're hopefully moving away from the healthcare science and using the term cardiac physiology because it's a more accurate term of what we do in cardiac physiology. So let's try and show you a short excerpt of what a typical day might look like in cardiac physiology. So what we can see there is North Wing at the University Hospital Southampton, and we're showing you a range of investigations there from our non-invasive skills, which will include echo and ECG, And there you can see an ECG being printed out from the screen. There's an image of an echo being performed by a cardiac physiologist. Here's on the invasive side, so that's someone's right coronary artery with dye being injected into it. So we work in a theatre type environment there, and you can see a chest x-ray there of a pacemaker been implanted to our patient. And there's a cath lab 3 here in Southampton, and that's part of the invasive world that we work in as part of our normal day-to-day routine. So here on this screen here, we can see a little bit more example of our non-invasive cardiology. So there's our 12-lead ECG, which is representing electrical activity, which is propagated to the surface of the skin, and we can detect that from the body, and we can look for arrhythmias, we can look for morphological abnormalities if someone's having a heart attack, if someone's got an arrhythmia. We would see all that from an ECG. So not only are we performing the test, but we also have to interpret that data. Now, bottom left there is a left ventricle, and that's using ultrasound to scan in through the chest, hit cardiac structures, reflect back to the probe, and we build up a moving image of the heart. And we can see we've got the left ventricle there at the basal portion, and the opening and closing there of a valve is the mitral valve. Structure and function of a patient's heart using ultrasound. And the image there on the right is showing someone on a stress test or a treadmill. So sometimes disease does not always present itself with the patient at rest. So what we would have to do there is put the heart under a workload, extra stress, and sometimes it's only then does disease manifest itself, because the heart is coping with resting conditions, and only when it has to work harder does disease sometimes show itself. So that might show itself or manifest on our ECG, on an echo, or it could be the patient's symptoms. So typically they might experience things like chest pain. So that's a non-invasive type investigations, and of course there we don't invade the body, and all the tests are done external to the body. And we work very much as an autonomous practitioner there. We're performing the tests and we're interpreting the data. In our invasive world, we work quite often as part of a multidisciplinary team. So that image you can see there on the left, that's a cardiac physiologist sat in the cath lab monitoring the ECG and pressure waveforms that are being recorded directly from inside the heart. And on the bottom right there, you can see where dye has been injected to the patient's coronary vessels, and we can see a narrowing there of their left anterior descending. So we'd be part of that team in detecting and treating that level of heart disease. Top right there, we can see a pacemaker. So the pacemaker is connected to the heart, and there you can see the 2 leads coming down and being located in the right atrium and in the right ventricle. So when the patient's own electrical activity starts to become unreliable or fails, a pacemaker will be implanted and take over that role. So we would be involved in the implantation of this device, and certainly once it's implanted, the patient comes back to see the cardiac physiologist, who will reprogram the pacemaker to make sure it's functioning correctly. So you can see not only are we performing diagnostic tests, but we're also delivering treatment in our role as being a cardiac physiologist. So the next question you might ask is, well, how do I get on the program? So our program is a 3-year program, undergraduate program, of course, here at Southampton. You can still see that we are a BSc Honours in Cardiac Physiology, open brackets, healthcare science. So we still belong to that parent generic term, but we are now known as just cardiac physiology. So our program, 3 years, made up of academic modules and work-based modules. So if you look at year 1, there's what we call a shared module. So it's professional practice, where you'll be studying alongside other healthcare professionals, physios, podiatrists, nurses. And the same with our scientific basis of healthcare science 1 and 2. That again is looking at a broad range of subjects that include anatomy and physiology, that makes sure that you have a good understanding of all the major bodily systems. On your SBCVRS, that's a specialist module, 1 and 2, and that is where you start getting to grips with your cardiac knowledge and respiratory knowledge. That all leads up to your first placement, your work-based training module in year 1. So everything we deliver from an academic perspective is all aimed at you working towards your placement, and this is what we call work-based training. So once that's complete, you can see in year 2 you come back for non-invasive cardiac physiology, where we increase the number of investigations that you can perform and report, and looking at much more complex cardiac diseases. Another shared module there, research methods. So this is giving you the tools to conduct a research project, which you do in year 3. So that's looking at service evaluation, audits, research, giving you the tools to allow you to produce a protocol that you can carry out in year 3. Our signal processing module is a little bit of physics, because as a cardiac physiologist, not only have you got to perform the test and again interpret the data, as we said, but there is an element of understanding a little bit of how the equipment works. So if we're seeing things from our equipment we're not happy with, then we would maybe question our results, or maybe interpret them in context with the equipment if there's an issue. Our pathophysiology is looking at the wider issues there of cardiovascular disease, and maybe looking at it from a public health perspective as well. And that's again another specialist module as part of your year 2. That all leads nicely into work-based training 2, which is a clinical placement, and we'll have a separate talk on clinical placements and procedures that you can perform. And this time we're into our invasive cardiac physiology. So this is our cath lab, pacing, what we call cardiac rhythm management, CRM, which is where you're working as part of a multidisciplinary team. We have another professional practice module, which is preparing you for working in the NHS as a graduate, as a band 5. And of course, we mentioned your research project, which you will perform whilst out on placement. And on our slide here, that's referring to work-based training 3. So each year, your clinical placements get a little bit longer and longer. So these red squares, rectangles, are just giving you a guide to when you should expect to go out on placement, and obviously the dates change slightly each year. So you can see in year 1 you've got roughly 10 weeks of practice. In year 2 you've got 15 weeks of clinical practice, and in year 3 25 weeks of clinical practice. So as I said, everything we do from an academic perspective is leading up to you going out on clinical placements, and we'll have a separate talk from our placement lead regarding clinical placements. So the next question we always get asked is, what do I need to get in? So we typically look for an ABB, and we'd like a science in there because this is a science degree, or equivalent. So something equivalent to our ABB would what we'd be looking for as an essential criteria. Desirable, so work experience, ideally in a health setting, but that is not essential. So if you've had a part-time job working in a takeaway, a restaurant, anywhere like that involves working with the public, that is good work experience, okay? And of course, we'd like you to know a little bit about what you're getting into, so make an understanding of a cardiac physiology and what we do and how we do it. And of course, relevant individual qualities, being sympathetic, team leader, motivated, working to a high level. Those are things we'd be looking for as part of our recruitment. Now let's look at life at uni. So here's Kish and Emma, bless them, who are our graduates and now work as qualified cardiac physiologists. And what you can see here, they're actually performing a range of investigations in our clinical skills lab. So one unique feature about the Southampton program is that we have our own dedicated classroom for the program, which is ours, we don't book it, and right next door we have our own skills lab, which is basically set up as a non-invasive cardiac department. And in fact, during COVID, the cardiac department upstairs moved into our facilities so they could continue delivering services to the public. So here's an ECG being performed by Kish and Emma, learning how to place the electrodes in the right place. And here they are. Here's their results of a 12-lead ECG. Now, if you were sat in front of me, I'd ask you to interpret this, but this ECG tells me this patient is having a heart attack, okay? So interpreting it correctly, escalating this patient's situation because we would need to act very quickly for this patient to hopefully salvage as much myocardium or heart muscle as possible. So that's one of our early investigations. Here's a non-invasive blood pressure being performed while someone is being stress tested. That's Christina, another graduate in our skills facility, demonstrating her ability to take a blood pressure whilst the patient was exercising. So So again, just shows you a little bit there about our skills facility, which we use throughout your time with us. Year 1, Year 2, Year 3, you are in the skills lab quite a lot. In your uniforms, practicing on model patients who will interact with you to make sure we prepare you for the clinical environment. It's not all hard work. This is our Christmas quiz. So we always have a Christmas quiz. So if you want to come on the program, you will need a Christmas jumper. They're the rules. And we can see some of our graduates there having a Christmas quiz and just relaxing and socializing together, which is fantastic. So at the end of the 3 years, which will fly by, trust me, you qualify into a Band 5 role. And this is a practitioner role within the NHS. But what you can see from this diagram is already there is a career structure waiting for you. So once you qualify as a Band 5, you can work your way up to a Band 6 and Band 7 when the department employs you. So there's a career framework waiting for you to join. Now this is the bit for mum and dad. So you can see here that we have pay scales in the NHS, and I said you qualify into a Band 5. Starting salary for a Band 5, at time of recording of course, is 24,907, and each year that goes up in increments, and the top of a Band 5 is over 30 grand. Not bad for your first post in the NHS. So that's the important bit. So there's a job waiting for you and there's a salary waiting for you. So you need to tell mum and dad that bit. So there's a purpose to the degree that you're studying. Job opportunities for you, well, they're all over the country. And although we are based here in Southampton on the south coast, our students, our graduates are working all over the country now. So we've got graduates in Blackpool, in Plymouth, in London, in Hastings, in Oxford, in Northampton, in Milton Keynes, in Portsmouth, in Bournemouth, in Salisbury. So wherever we have placements, there are our graduates working in those departments. So the job opportunities are phenomenal. What are the benefits of working for the NHS? Well, as I said, you've got a career pathway there waiting for you. The NHS pension is a very good pension, and although you're young people, you probably still need to be thinking about that one now. If you're poorly, the NHS will still pay you. So you can go on to sick pay. You're going to get so much annual leave every year, and that includes your bank holidays, Christmas and Easter. And I would even say there that there's flexible working. So some of our graduates are working 4 long days and having 3 off. Other people are doing, 5 normal days. It does vary. And even to the point where we have people who've gone off, had children come back, and they're working part-time rather than full-time because the department would rather have you than not have you. One of the greatest benefits of working in the arena is that you do make a difference to people's lives. And you do it on a daily basis, and it just becomes routine for us to make that difference to patients' lives. Now, let's look at some of our graduates. So look at these people. So they were all here just over a year ago, and they're all now working in the NHS, working throughout COVID, delivering cardiac services, and they were all trained in our clinical facilities, preparing them for working in the NHS during a pandemic. And these are all now doing marvellous jobs now around the country. And this could be you in 3 years. So what's the next step? Well, find out more information, go online, look at the University of Southampton website, look at the Cardiac Physiology website for the programme. If you could get a visit to a department, even better. So if you've got a local cardiac department, if you got in contact with them, said, could I what you're getting into? Because everything we do as a cardiac physiologist involves a patient, direct contact with a patient. So you have to remember that when you're finding out more about the role. Okay. So now I would be asking you if there are any questions, and of course it's very difficult to talk to me like this, but if there are, you can always contact our admissions team and they can always forward it on to us, and maybe you may discover a career that you didn't know existed. But whatever you do, I wish you well and success with any career choice that you take.
Hello, I'd just like to introduce myself. I'm Dr. Sally Sampson. I'm a lecturer on the Cardiac Physiology degree programme at the University of Southampton, and I'm also the placement lead. This is just one in a series of videos that have been created about the Cardiac Physiology programme at the University of Southampton. You should previously have seen some presentations about both the programme and the profession as a cardiac physiologist. I'm going to move on now and talk about clinical placements. So I'm going to be talking about the role of clinical placements within the degree programme. So where do the clinical placements fit into the programme? Well, students spend time at university studying the academic theory, plus they're developing clinical skills, which they all need once they're a qualified physiologist. And they're taught their clinical skills whilst they're at university in the skills lab, and we have whole week practical sessions at a time when students are taught skills and allowed to practice them on model patients. But once they've done that, they really need to put those skills into practice in the real world and actually be testing patients out in hospitals. And this is what they can do while they're on placement. So I'm just going to show you next where placements fit in to our curriculum. So in year one, you can see there are two short blocks of placement. There's one in about January time and a further one later in the summer. In year two, there's a longer time spent on placement, and in year three you can see the majority of that year, given that students complete the programme in July-August time, most of that year is spent out on placement. So placements increase in length as the students' knowledge and skills increase. So in year one, students will cover some basic modules at university, looking at introduction to professional practice, so learning really how the National Health Service works. They learn things like patient confidentiality and manual handling. They have a course that covers all the basics of physiology of all body systems and some other aspects. And then they have the scientific basis of cardiovascular, respiratory and sleep science, which is learning all about normal in cardiac physiology. And they learn practical skills to augment this. So they learn how to perform a 12-lead ECG, how to perform manual blood pressure, and how to set up ambulatory devices. Now, where does placement fit in this first year? Well, students will spend 2 weeks in placement, as I say, in about the January of that first year, and that's an observation placement only. So they're really just observing the role of a cardiac physiologist and how the department works and fits into the hospital environment as a whole. But when they go out on their second placement at the end of that year, sort of May, June time, they're spending 6 weeks on placement, and this is where they're performing those skills that they learn in the skills lab at university. So they will be actually performing ECGs and manual blood pressures and setting up those ambulatory devices. Now, while students are on placement, we do support them, both them and the placements. So we're always in contact via email, and we also will come and make at least one visit during every student placement. And we find that while students are on placement, they gain in confidence as they get experience in a clinical environment. So moving on to year 2, the academic modules are leaning more towards the cardiac physiology side of things. They're learning about instrumentation, how the equipment's actually working. They're learning about public health as a whole, to think of the bigger picture of factors affecting cardiac physiology. And they also have a module on research methods, and then their specialist module. And year 2, it is all about non-invasive cardiac physiology, and the skills that are learnt reflect this. So as well as the skills they learnt in the first year, they're now going on to interpret those ECGs that they performed and recognise abnormal ECGs and be able to interpret these, and the same with the ambulatory devices. And in year 2, students will also be learning about stress testing, whether that be treadmill testing or echo. So one thing to stress is that when students are on placement, they're not just there gaining experience. We require them to develop a clinical portfolio of evidence. So while they're out there, they're gathering evidence of every test that they perform. And they are also assessed on their practice whilst they're out on placement. And that's because all placements have academic credit, and as such, they all contribute towards the student's degree. So if we move on to year 3 now, again, there's a module that's on future professional practice. They've then got a module on research projects, and this spans both the time at university and when they're on placement. And then they're moving now into invasive cardiac physiology. So this means that when they're out on their 25-week year 3 placement, they're performing both invasive and non-invasive diagnostic techniques. There's a big step up in the degree of complexity involved. But in addition to this, they're also collecting evidence for their research project whilst they're out on placement. So you may ask, few more questions. Where do students go on placement? Well, we can usually send 1 or 2 students to each hospital. Most cardiac physiology departments are not huge on the grand scale. If you compare it with the number of nurses within a hospital, most hospitals will have between about 10 and 20 cardiac physiologists. So our placements are quite widely scattered. Including University Hospital Southampton itself, but we also have placements at Portsmouth, Chichester, Bournemouth and Poole, and Basingstoke and Salisbury, all of which our students get sent on placement. And then we move right across down from Plymouth in the far west across to Hastings. We have students at Papworth Hospital at Cambridge. We've even gone up as far as north as Blackpool. We usually try and arrange that placements, I will discuss them with the students, so that students have placements somewhere close either to their home address or to Southampton. It's arranged and discussed with students. So that's a brief overview of placements at the University of Southampton. So I hope you enjoy the rest of the videos today. Thank you very much.